Here's a diagram showing the trigeminal nerve, and this is divided into three branches: the ophthalmic, the maxillary, and the mandibular nerves. And in this picture, each correspond to a color. So the ophthalmic is in pink, the maxillary is in green, and the mandibular is in yellow. And since the trigeminal nerve is a mixed nerve, the motor and the sensory nuclei are located in the pons. In this slide, we're going to be talking about each of the three branches and the paths they take to receive sensory and motor information. First, let's talk about the ophthalmic nerve that is pictured here in pink. And this leaves the trigeminal ganglion, then the pons, and goes away from the skull via the superior orbital fissure. And after that, it branches off even more into three sections. First, the frontal, which moves towards the forehead and scalp area. The other is lacrimal, which goes towards the lacrimal gland. And lastly, the nasociliary, which moves down to the nasal cavity and eye. Next is the maxillary nerve, which is in green. And this first exits the pons from the trigeminal ganglion through the lateral wall of the cavernous sinus and out of the skull via the foramen rotundum. From there, the maxillary nerve also branches off into areas that it will receive sensory information from. And lastly, the mandibular nerve, and that is pictured here in yellow. So like the rest, it exits the trigeminal ganglion and the pons out of the skull from the foramen ovale of the sphenoid, and sections off into smaller branches ranging from the temporalis muscle above the ear all the way down to the mylohyoid muscle and many other things in between. The trigeminal nerve is both motor and sensory. The ophthalmic nerve is a sensory nerve which receives its information from the skin of the upper face, the forehead and scalp, the eyes, including the cornea, iris, and upper eyelid, also the nasal cavity, and the lacrimal gland. And this next branch is the maxillary nerve, which is also completely sensory. And this transmits information from the lower eyelid, the skin on the sides of the nose, the upper jaw, the teeth, the upper lip, the maxillary sinuses, and the nasopharynx. The third and final branch is the mandibular nerve, and this is both sensory and motor. First, let's talk about the sensory. This allows us to have feeling in the mandible, the lower teeth, the lower gums, the lower lip, the external auditory meatus, and auricle. And the motor component of the mandibular nerve allows us to chew, and it keeps our jaw in place, and it also keeps the tongue in place. This nerve innervates muscles of mastication, so chewing, the tensor tympani, which is one muscle in the middle ear that regulates movement of those small little bones, the mylohyoid, which is a neck muscle that helps support the tongue, and the inferior digastricus, which is another neck muscle that helps support the jaw. If there's damage to the ophthalmic nerve, you're not going to have a bilateral response to unilateral stimulus, meaning if someone or something touches your eye, the reflex of blinking will only work for one eye, when ideally it's usually both of the eyes that will close. If there's damage done to one of the branches of the trigeminal nerve, such as nerve injury or a nerve lesion, one could develop trigeminal neuralgia, and it's characterized by extreme, chronic, sporadic pain. If there's damage being done to the afferent component of the mandibular nerve, then you would lose sensation of the lower teeth, the lower lips, the gums, and the skin around that area, which then can lead to articulation and intelligibility problems when speaking. And if there was damage to the efferent component of the mandibular nerve, then you would lose control of your jaw, like your ability to chew and to keep it in place. In the middle ear, you wouldn't have that protection of those three little muscles to allow stimulus.